Hi everyone, welcome to Nityal Lab Podcast. I'm your host Nityal Kumar. I'm an assistant professor specialized in musculoskeletal and sports physical therapy. During my clinical practice or during teaching or during my lectures, I identify many different patterns. And in that particular patterns, pain neuroscience education is always fascinating. So when I go in terms of educating, I always see in terms of how these interactions between the biological, psychological, as well as the sociological patterns happen, and how these particular changes will give a permanent changes. For example, when we ask an individual to do an activity, they may do, they may not do. But few individuals' recovery pattern is going to be very fast, and few individuals is going to be very slow. And when we go in terms of the deep neuroscience behind each and every component, we can identify the multiple pattern recognition of how this happens and how the interaction happens. In this podcast series, we'll deep dive into most of the musculo, cardio, neuro, and other conditions of these particular ailments which we generally treat. We will deep dive into the neuroscience behind each and every component. Say it could be in terms of chronic pain, chronic low back pain, or chronic neck pain. We will not go segment wise. The main purpose of this podcast is to deep dive to each and every component to identify how the biobehavioral aspects. So when you see an individual with pain, how the psychology predominates or how the physical pain predominates and why they don't adhere to few activities or few exercises are these domains which we need to work on. As a health educators, we need to make sure we understand the perspective of the patient and we have to identify the patterns of how to educate them and how to make the individuals adhere to the exercise regime as well as the lifestyle modification which we perceive. The podcasts have been planned in such a way that we will deep dive 1 month. We will give, for example, if it is low back pain, we'll deep dive regarding all patterns of how the therapy works, what are the evidences, and what are the neuroscience behind each and every component, and how to incorporate these particular modules of education into the clinical practice. And the next month, we'll go to the other topic. So, this will have 4 different episodes, and every episode is going to come on Sunday at 10 a.m. So this will be a deep dive of individual interactions of how the brain and how the physical activity is going to give something called as a mindfulness. We wanted to make this holistic and I would like to bring this as a holistic purpose. We will deep dive in physical therapy, we'll bring experts, we'll ask those experts also their opinion regarding how we can enhance our particular practice in terms of the profession. We will see in terms of physical therapy, physical activity, pain modulation, mental health, and other different approaches which are going to help in terms of the patient population. In this month, we have identified low back pain as the low back pain awareness month. So the next episode is going to be on neuroscience of low back pain. We'll deep dive into the what is the neuroscience of chronic pain and what is the neuroscience of general pain. So usually low back pain will have 2 different types of courses. One is normal course, other one is abnormal course. We'll identify these 2 patterns and we'll see how to make sure we identify those particular patterns and what are the science behind those particular components. For further updates on neuroscience and further updates on the holistic approaches we generally use in healthcare, please follow my podcast. We'll see you in the next episode. Thank you.